Anomabo lies on Ghana's central coastline and occupies a special place in the country's history as one of the first ports of call for ancient European traders. Today, Anomabo is a relatively quiet town that still prides itself on its strong bond with the sea. There is little economic activity except fishing. A faint oil rig offshore suggests that oil production is not far from here. But most people in this old historic town earn less than $1 a day and are poor by global and Ghanaian standards. Today, the sea is rough, so the fishermen are not out at sea yet, which is good news for Kwame and Tifo. Traditional fishing is hard physical work and his back pain is getting worse. Kwame has complained for years but has never gone to see a doctor because of the cost. In such a poor community with low health insurance enrollment, Kwame is not alone in avoiding the hospital. Abafachi had twins, but one died because she had no money to take her to the hospital. To eliminate such barriers to accessing critical health care, the National Health Insurance Scheme was introduced in 2004, replacing the cash and carry system. With a payment of a yearly premium, all citizens are now entitled to free medical services. The benefits to poor communities are obvious. Across Ghana, enrollment for the National Health Insurance Scheme now stands at 15 million, a massive increase over the last few years. Enrollment figures in Anomabo is 9%, which is way below the national and regional average of 50%. This unique scheme is, however, not without its challenges. On the community level, inadequate information and persistent socio-economic barriers still prevent millions from enrolling. This is where Shine Ghana's multi-stakeholder problem-solving groups assume critical significance in ensuring quality health service for the poor. A key feature of the problem-solving groups is the involvement of the National Health Insurance Scheme, service providers, and the community. Their primary role is to identify challenges and find local solutions to local problems in order to increase enrollment. Francis Yankson represents the health insurance scheme. Nana Kofi Ankechi is the traditional leader of Anomabo.
So we have insurance about the hospital. Obefia no say hospital for one show ye, nurse for one show ye. Nzamobi opelo obayadi ni binokra na wa twasan.
Adwose Watutu is a nurse at the Anomabo Health Center.
If I change say omo buy a young basabaso. Most of the time omo kra health insurance card do mu nya botre e ma yen fele claim forms. So when nya botre amebia one fele forms ya ye de kwa health insurance full enchia. Sometimes time money pa ko ne beba de bi wa one nurse no be ye adwuma san fiti anopa e ko pi menyumre tie bia obeba na ye nyumre time na nurse no wa brain na ye bi wa ha ba ne sa no.
Doreen Spencer works as a community-based health agent.
Se work already sir, what's the health insurance from? One flower card and bantam. What's it now 6 months and sana card no beba. So what's the one register bill?
Sometimes the delay issues are beyond us, but we've been doing our best at the district level to make sure that the delay is cut down.
Mr. Sebastian Sarr is the chairman of the Drivers Union in Anomabo.
Na driver na so mo bo am there ya ho so wo asama an there car na wo kaninti wo ya da gira o wo there we den wo kay national health insurance ni bi na mo pepi say hia ka say e botum na ya kokko ho redza no so wo ba wo botum wa den wo botum wa ye.
And Dora Parker, a community worker, all giving their focused attention to a range of challenges, health misconceptions, card delays, and above all poverty and low incomes, the most persistent barrier to enrollment. It's morning in Anomabo, and the boats are set out to sea. A good time for Dora Parker, member of the problem-solving groups, to start her community rounds.
If you had insurance, when I say, Krata na wadu kwa hospital. Pocho hospital krata ni will be an.
Pocho maybe
Krata no lo buan kwafo papa. Say we be na kwa hospital won je ohwe. Nti bombodin na yebi. Na yebi ma womba na wona na anu nyina. Nso Obama etumi sieska da ye wada epede edi ye da achi nyina. Oda enya ho abotar na enye ho kasa na chechemi kire ho.
Meanwhile, Kwame Ntifel and his colleague have arrived at the house of their boss, the boat owner. He is not too pleased to see them.
Why none one couple no asan which we feel.
Nana say you could me capture the me yam McKenzie, for someone from hospital, McCann Castle.
No, so none was men with you and a pay.
But Malaria are coming to me 2 man creduma.
And the scum of one so I saw call.
Scared the man from hospital, scanner on the baby. I call what a question, quick history. Doctor Subeji, Beji, scanner on Subaby.
Agofia.
Dora Parker chances on them at the appropriate moment.
Health insurance ma bu for yen yakra nti abanda wo de mu wawru fiefi na wi abi me de bepu ha na me pede me bisa mo de mu wo bi ana na papa wo me wasi wenyi bi na dawo wan de botu esika na ye twa mfanyin itwa mfanyin na busum ebaasa na wade krata no ba mo nti wo beti nka wade yi wada mo obi ni din nti wonja na wanhwe na iso nye mo otwetu kra yibotum da ko hospital wo be biara wa Ghana ha nti demokrata ibe kita wunsema afi enum ansa na wasesa krata na mo na mbom afi biara e basesa
na moko scan no obejem
mpocho ya todo ama obiara wetum waye nti oye Ghana sidu du anan nkan 140
man yeah krata ni bi fama he dan is ka kra me the hospital. You go to skin now, so all see down there. I say, Shabusa, on our phone, and the Wasan affair to shall answer you for my
sister. My dad to my yama.
I mean, I never passed the one.
Yo papa muso madasi pi de maba sama mekan ajatum oye de owade mukọ efiefi wa abo ahena kura nchegbo nwona ifie bi me na asama wesi wonye epo wenyi ne nama na bibia ase wo kroma abofa ba yer wonyi ska wadene bokwa hospital na odawa na wewu dem sami nyina ande yantibio.
A few miles down the coast from Anomabo is Salt Pond, the district administration center for the National Health Insurance Scheme. It's a busy morning as usual, as more people enroll or renew their membership of the health scheme. The staff keep a cheerful demeanor, but it is clear that they could do with more space and facilities due to the increasing public demand, especially in the record section, where vital data and records demand urgent attention. Mr. Godfred J.B. Arthur is the manager here and has been doing his best. Another challenge is human resource.
We are highly understaffed.
In spite of these challenges, the benefits to community healthcare are clear.
My insurance nibi, by 2 years ni, na my baby renewed. Last year June, ya be takima na mention kwa na my hospital. Oma meduma mukwe na numu ne yedin omesa ba waji moto na oma mndura ahuru bebre meje drip 9 ni nyina sanye the insurance na nchemi yiska ntuaka ni yiska mede beye ndama bebre nti same ya na meba na mekita insurance na obwa bebre
sanye health insurance nti mfide bia nche yempent dem but me fide bia health insurance o yad pepenti nti me yem mofo me na adin me ho bede bia we who have my baba register one.
10 biara to Muko Hospital workshop where you will do fine. Insurance no ye, papa boy.
Balagaza! At Anomabo Taxi Rank, it's a brisk, busy morning for the drivers, as well as Mr. Sebastian Saar, member of the problem-solving group.
Adena ne bibi ne accident bisa. Ya nwochiri oyiska samso ndi samu boama obandama obobo hepi bi so passengers so our car mu oya ho so mutuma ka che ho.
Some drivers still need convincing.
Ne nyina oyi national health insurance ni bibi ayi pepe.
Yo okay medasi a kire mu na me so question bisa.
mepere ma so bi so question mepere mi bi so question wokali mepere mi bi so na wokali insurance wo ho nti say dey eguma mfe bia na say yin accident a afidu ansa nkoto ebi o
beko ekoto ebi
the man na insurance
oyimpa hu insurance no so wale to car zo ha emi nkomintu onam de car ni zi asaya ezi ko fitem na kan.
Elsewhere in the taxi rank, Kwame Bedu proudly displays his card. Eventually, our inquiring driver agrees to take a card. We leave the coast and head north into the forest region. Our destination, Asin Achiano, a remote farming community. A sign on the roadside indicates the presence of Shine Ghana's problem-solving groups. We soon catch up with them on their daily rounds. Opinion Kojo, the cocoa farmer, was persuaded to take a card, and he has not regretted it. Adra Mainu is also a farmer. A member of the problem-solving group regularly visits Adra Mainu. Just recently, she was convinced to enroll. But it has not been easy for the problem-solving group.
Apemfo say na omo entumi enye insurance no kra na Shine Ghana ba achia no ha no a ye chechire omo ano pemfo bia ne achia no ha no a say onkuta insurance
ojedi say enta me ni next year de na kuyi de na obia ye.
A song of praise seems in order as we leave Asin Achiano. The outreach also takes the message to schools, where the response has been positive. In the distance, a sick man approaches. It is our good friend Kwame Ntifu, whose back pain is now unbearable. He explains to the nurse and proudly takes out his national insurance card. 20 months after the introduction of the problem-solving groups in Anomabo and Asin Achiano, enrollment in the health scheme has improved tremendously. Household enrollment in Anomabo rose from 9.2% to 15.4%, and in Asin Achiano from 18.2% to 40%. For Kwame Ntifu, free treatment is possible for him for the first time in his life, and he is grateful, a testimony to a great idea, multi-stakeholder problem-solving groups, helping to reduce poverty and bring health insurance to all.
I'm a pedam for them na me da Shine Ghana as a papa da wotumina wadi da mujumezi sunoti dam waze aba omanimu nkankara Anomabo mayaze ankasa mumbo nsem mfama mo ho mayaze